first and last name and your date of birth?
Lacey Lung, 3494.
Okay, perfect. Well, my name is Lana. I'm going to be your sonographer today. Go ahead and lift up your shirt and you can lower your pants all the way down to your hips. We're going to take a look at baby from head to toe. We're going to take lots of measurements, lots of pictures, and I'll be able to tell you the size and the weight and all that good stuff, okay?
Okay.
So baby has bottom down. Legs are crossed. Oh, uncrossed. And you're having a boy. Congratulations.
We were gonna have a gender reveal. We have our whole family coming in this weekend, and they're gonna like blow up like stuff to be pink or blue, and we didn't want to know.
So give me your name and your date of birth.
Lacey Lung, 3494.
Perfect. And my name is Lana. I'm going to be your sonographer today. You can go ahead and lay on back. You can lift up your shirt and lower your pants all the way down to your hips. We're going to take a look at baby from head to toe. We're going to take lots of measurements, and then we'll be able to tell you the gender, okay?
Okay.
Wanting to know what the gender is today?
Actually, we would want you to put it in an envelope, so don't tell us. We're gonna have this awesome gender reveal party this weekend, so I'm gonna give that envelope to my sister.
Okay.
Instead of telling us the gender before asking us if we wanted to know, Lana changed what she did, and she asked if she wanted to know the gender of the baby before she told us.
My name's Jim. I'm the sonographer here. This is Lacey, my student. She's
Hi.
actually going to be doing your exam.
Okay.
So if you'll go ahead and lay flat on the bed, and Lacey will get you taken care of.
What's your name and birthday?
It's Fairy.
All right, so I'm gonna have you lift your shirt up for me and kind of lower your pants around your hips. I'm gonna tuck this in. All right. I'm gonna put some gel. It's a little cold, okay? Okay. We're gonna take lots of measurements of baby from head to toe. Do you know what you're having?
Now I can't wait to see you.
Oh, it's so exciting. So right now we're actually gonna take a look at baby's bladder. You can see it's that black dot right there. Do you see how big that bladder is? It's huge! I also noticed that there's like not very much amniotic fluid, and that since that bladder is so big, does that mean that there's a bladder outlet obstruction and it could maybe cause preterm belly syndrome?
Well, it could. I'm not a regular sonographer. I'm a cool sonographer, so I can tell you anything.
What does that mean?
Hi, my name's Jim. I'm the sonographer here. This is Lacey, my student. She's
Hi.
actually going to be doing your exam.
Okay.
So if you'll go ahead and lay flat on the bed, and Lacey will get you taken care of.
What's your name and birthday?
It's Fairy.
All right, so we're gonna look all over and do a ton of measurements.
Oh, yeah.
Right now, I'm looking at baby's bladder. That's that little black dot right there.
Is it okay? Is it normal?
Well, actually, I'm not able to tell you any results. What we're gonna do is we're gonna take all of these images that we take and send them off to the radiologist, and they'll make a report, send it to your doctor, so you'll get those results in about 2 days, okay?
Okay, that makes me feel better.
Never discuss pathology in front of a patient. It will make them feel very nervous, and sometimes we could be wrong. We need to wait for the results from the radiologist.
Okay, I'm gonna have you verify your first name and your date of birth for me.
Billy Joe Rowe, and it's May 15th, 1995.
Okay, go ahead and have a seat. I'm gonna ask you a few questions before we get started, okay?
Okay.
So how long has this been happening? How long have you been having some pain?
Well, since last week when my girlfriend kicked me in the balls, she caught me cheating.
All right then. Okay. We're gonna be doing a scrotal exam today, so I'm just gonna have you change. I'm gonna step out and then I'll come back in, okay?
Okay, sounds good. Now, what was I supposed to do?
You ready?
Well, I guess.
Okay. I'm gonna have verify your first name and your date of birth for me?
Billy Joe Rowe, and it's May 15th, 1995.
Okay, go ahead and have a seat. I'm going to ask you a few questions before we get started, okay?
Okay.
So how long has this been happening? How long have you been having some pain?
Well, since last week when my girlfriend kicked me in the balls. She caught me cheating.
So we're going to do an ultrasound of your scrotum today. Have you had that done before?
No, I haven't.
Okay, so I'm going to step out. I'm going to let you undress from the waist down. I have this sheet here so you can cover up, and then I'll be right back, okay? Do you have any questions for me?
No, I don't.
Okay,
Thank you.
you're welcome. You ready?
Ready, ready.
Lana didn't give clear and direct instructions on what the patient should do whenever she left the first time. She corrected that by giving him instructions as well as asking if he understood.
So Jim, it looks like we have some stats upstairs.
Okay, I'm gonna go take room 1 portable.
Okay, okay.
I will grab this outpatient, take him to room 1.
Okay.
Lacey, Lung. Are you on one of these photos? Can we Okay. Getting ready for your ultrasound today.
Okay.
We're going to be in this machine right here.
There's not a machine here.
So Jim, it looks like we have some stats upstairs.
Okay, I'm gonna go take room 1 portable.
Okay, okay.
Maybe we'll get that outpatient into room 1.
Jim took that machine for portable, so take your patient into room 2.
Okay, thanks for telling me.
You're welcome.
Okay. In this scenario, they didn't know that Jim took the machine to go portable. In the second scenario, Lana fixed it by informing Fairy that that room had the machine gone, so she was able to take a patient to a room with a machine.
And Jim, I had the craziest patients today.
Oh, really?
Yeah, the patient in room 2, they have the cancer.
Wow.
They gon' die.
Oh my god.
Okay. Are you talking about room 2?
Uh-huh.
That's my sister. I didn't know she had cancer.
Oh.
That's my baby sister.
Oh, okay.
That door.
Jim, I had the craziest patients today. I had this patient in
Oh,
like room.
no, we shouldn't talk about that. That's a HIPAA violation.
What?
Yeah, we'll talk about it later, or not at all.
Okay.
In this scenario, Jim reminded Lana that you're not to discuss patient information on an elevator, especially if it's not pertinent information. That should be disclosed in an appropriate place so that patients are not overhearing and you are not at risk of a HIPAA violation and consequences.
What's ultrasound's number?
Hello?
Is this ultrasound? I need a superstat pelvis done, like, yesterday.
Okay, well, what's the patient's name?
Mary Fallon. She's been here for 30 minutes and the teachers are coming for her.
Okay, well, that's not my problem, but we'll get it done.
Already did. Get it done now.
I hate that doctor. Whatever, let's get it done. Fallon? Mary? Alright, we're gonna just be in this room over here. If you wanna lay down there for me. Okay, so can you tell me your name and birthday?
Mary Fallon, May 5th, 1960.
Okay. All right, so what the doctor ordered today is a pelvic ultrasound. We're gonna get that started. We're gonna start on top, and if we need to, we'll have to do the transvaginal ultrasound if we can't see very well, okay?
Okay.
All right, well, let's get it started. Just so you can have a little bit more privacy. All right, we're gonna start with the transabdominal. So I'm gonna have you lift up your shirt for me. And then I'm gonna, pull those pants down just a little bit and I'm gonna tuck this in. All right, I'm gonna get started here. All right, well, I hate to tell you, but the images just weren't very detailed. So what we're gonna do is we're gonna do that transvaginal, just so we can get a better look. What I'm gonna do is I'm gonna step out and let you use the restroom and empty your bladder completely. And then I'm gonna give you a cover to cover up with, and you can just put your feet in the stirrups and dress from the waist down, and use that to cover up with, and I'll be right back, okay? Do you have any questions?
I don't think so.
Okay, I'll be right back. Are you ready?
Yeah.
All right. Have you scoop your bottom down just like it's kind of hanging off the edge of the bed for me there. Okay. You're going to feel some pressure, but it shouldn't be uncomfortable. Okay. Now look to insert. Is that okay?
Mm-hmm.
All right. Okay, well, we're all done, so I'm gonna take it out now. Okay. So these images will be sent off to the radiologist, and they're gonna make a report and get it to your doctor, so you should hear back from them in about 2 or 3 days, okay?
2 or 3 days?
Yeah.
Who is the radiologist reading this? Maybe I need to speak with him. Because
Um,
my doctor called and this was supposed to be done stat.
Why am I looking at pictures of her uterus? This should be a pelvic ultrasound. What's ultrasound's number?
Hello?
Why are these images of the uterus? I wanted to look at her kidneys.
You wanted to look at the kidneys? I thought you wanted a pelvic ultrasound. That's what you ordered.
That's right, a pelvic ultrasound. Her kidneys are in her pelvis.
I'm sorry. I didn't know you wanted to look at her kidneys. I just did what the order was for.
Why would I want to look at her uterus when she has decreased urine output? Idiot.
Okay, well, if you put in that renal order, I will get it done as soon as possible. I'm so sorry. Hello?
Is this ultrasound?
Yeah?
I need a superstat pelvis done, like, yesterday.
Okay, what's the patient's name and what's going on?
It's Mary Fallon. We're afraid she's going into kidney failure. Her urine output is really low. The teachers are coming for her.
Oh, okay. Well, that actually wouldn't be a pelvic ultrasound. That would be a renal ultrasound. So, can you go in and do a new order with it under renal?
I didn't know that wasn't a pelvic. I'll put it in as a renal instead.
We'll get it done, okay? Fallon, Mary? All right, so can you give me your name and birthday?
Mary Fallon, May 5th, 1960.
Okay. So what's been going on? Why are you coming to see me today?
Well, I went to the doctor because I haven't been peeing very much and I seem to be retaining water really bad.
Okay, so we're gonna take a look at your kidneys. That's what they ordered. Does that sound about right?
Okay.
Okay, so what I'm gonna have you do is I'm gonna have you lift up your shirt and lower your pants to your hips, and I'm gonna tuck this towel in here. All right, and then I'm gonna close this curtain to give you a little bit more privacy, okay? All right, well, I'm done looking at your kidneys and bladder. I'm gonna send these images off to our radiologist, and they're gonna make a report. And your doctor should be letting you know, like, really soon, probably sometime later today, because it was ordered stat, so.
Okay. Okay.
Hello?
I saw you got the renal ultrasound. It looks really good. Thank you.
In this scenario, the sonographer did not clarify the indication for the study, and she also didn't talk to the patient about their symptoms. So she wasn't able to realize that she was doing the wrong study and that it should not be a pelvic ultrasound. To fix this, the sonographer asked for the indication from the radiologist and asked the patient about the symptoms that they were experiencing to make sure that they were doing the correct ultrasound.
Okay, I'm gonna go get that leg.
Okay.
Lung?
That's me.
Okay, we'll be right
Sorry, my legs don't move that fast
Oh, it's
anymore.
okay.
They've been so swollen.
We'll get you taken care of. We'll be right through here.
Oh no, my shoes kind of untied. Oh no. Oh no. Can you hold my hand? I don't want to trip because my shoelaces.
Okay, we'll
Okay.
just be right over here.
That far?
Uh-huh.
Okay.
So what's your name and birthday?
What? I can't hear you, son. You're gonna have to speak up.
What is your name and birthday?
Oh, my name, son, is Lucille Lung, and my birthday, March 4th, 1939, I think, and you need to be careful with that cough. You can't be getting me sick, son.
Okay, I'm sorry. Can you tell me what's going on today?
What?
Can you tell me what's going on today?
Oh, well, doctor sent me here because my legs, they're just swelling. And when you get my age, they just don't work the same way that they did when they're, like when you are, so. But yeah, they just been swelling. I can barely fit my shoes on. That's probably why my shoelace came untied.
Okay. Well, what I'm gonna do is
Speak up, son.
What I'm gonna do is I'm gonna step out. I'm gonna have you undress from the waist down,
Oh,
just your underwear on,
okay.
and I'm gonna give you this sheet,
Oh, okay.
and you're gonna cover up with that.
Oh, okay. All right.
Okay.
Oh, thank you so much. I'll get ready for you.
Okay, I'll be
You
right
mind
back.
helping me off the bed?
Sure.
Oh, thank you.
I'll be right back.
Okay.
Are you ready?
What, son?
Are you ready?
Oh yeah, I've been ready for a couple minutes.
Okay, I'm coming in.
Okay. So cold in here.
I know, I'm sorry. We have to keep it cold for the ultrasound machine. Okay, I'm gonna uncover your...
What?
I'm going to uncover your right leg
Okay.
and start at your groin.
Oh, okay.
Okay. Okay, I'm gonna start now.
Okay. Oh, that's cold.
I am sorry. We don't have a warmer here.
What?
We don't have a warmer in this room.
Oh,
So I am very sorry.
it's okay, son.
Okay, I'm gonna do the exam now.
Okay. Ah! What was that? That hurt so bad. Why did you press down on me? You didn't tell me you were gonna do that.
I am so sorry. I meant to tell you. Lung?
That's me.
Okay, we'll be right through this way.
Honey, you're gonna have to slow down there. My legs don't move that fast. Or they've been so swollen.
We'll get you taken care of. We'll be right through here.
Oh no.
Okay.
Okay.
Let's be right over here.
That far?
Uh-huh.
Okay.
Okay, can you hop up on the bed?
I'll try, but I'm a little slow nowadays.
Okay. Well, what I'm gonna do, I'm gonna step out. I'm gonna have you undress from the waist down, keep your underwear on, and then cover up with the sheet, and I'll be right back. Okay? Are you ready?
Yeah, come on in. I've been ready for a while now, son. What's taking you so long?
I'm sorry. I have had some paperwork I had to put in.
Oh, paperwork.
I know. All the paperwork.
Okay, so what are we doing?
We're doing a lower extremity venous ultrasound.
Okay.
I'm going to be starting up high in your groin. I'm going to uncover your right leg. And
Okay.
as I go down, I'm going to do slight compressions, okay? And if it's too uncomfortable, you let me know. But this is the best test.
Oh, does it hurt real bad?
It
Because
might-
my legs, they're so swollen and
I
they're
know.
real sensitive.
This might hurt a little bit, but this is the best exam for your doctor,
But
okay?
it'll go real fast, right?
We'll try to make it go fast.
Okay. Well, we gotta do what we gotta do.
Right. I'm going to uncover this right leg, okay?
Okay.
And tuck this right up in your groin so
Okay.
you don't get gel all over you.
Oh yeah,
more than
that
you-
wouldn't be very good. I don't want it on my undies.
Right. And unfortunately, this gel's a little bit cold. We don't have a warmer in here, okay?
What did you say?
We don't have a warmer.
For what?
The gel.
Oh. Well, you're right. That did hurt, but I understand it's what you need to do.
I know. Just bear with me, okay?
Ugh. Ow. Ugh.
Okay, I'm gonna go behind your knee now, okay?
Okay, that's where it hurts the most.
Okay,
be,
well,
be
just-
gentle, okay?
Just bear with me, okay?
Ah! Oh my! Don't mind me. Don't mind me. I'm okay. Just it
I
hurts
am
really
so
bad.
sorry. I gotta do it again, okay?
Okay. Ugh. Ugh. Are we almost done?
We're almost done with this leg.
Oh, we gotta do the other leg?
Yes, unfortunately.
Oh, okay, I understand.
Okay, we're all done with this leg.
Oh, thank God.
We're gonna go to the left
Are we
leg
gonna
now.
do the-
Okay, I'm done with the
What?
exam. Okay, I am done
Oh, thank
with
God.
the exam.
Oh, okay.
I am going to get the doctor.
The what?
The doctor.
Oh, okay.
Okay,
Are they gonna come in here?
they will be in here in just a minute.
Okay, good.
Okay, it was nice meeting you.
Yeah, am I allowed to cover my leg up?
Yes, I'll cover it up for you.
Oh, thank you. So cold. What? You gotta speak up, honey.
Lucille?
That's me.
Okay. I'm Dr. Borta.
What?
I'm Dr. Borta.
Oh, hi, doctor.
Hi. It's a good thing we did this exam
What?
today. It's a good thing we did this exam today.
Oh, really?
Yes, you have blood clots in both legs. Big ones. Like, huge.
Well, Then in that case, I'm glad that that young man was so helpful and he explained that what we'd be doing and looking at the ultrasound for me and that he'd be squeezing on my legs. I'm so glad. I know it hurt so bad, but I'm glad that he was a good communicator and was able to help me get that done because I need these legs to work longer. I've still got a lot of years left in me.
In the first scenario, Jim did not describe the procedures going to be done on the ultrasound. So whenever he compressed her leg, she did not cooperate and was not able to get the results she needed because she did not cooperate during the exam. But the second situation, Jim fixed that by thoroughly describing what he would be doing so she was able to tolerate the compressions and get the results that she needs.
Remember, always meet the communication needs of the patient.
What?
Lord? Okay. Oh, why are you gripping your side?
My side hurts really, really bad.
What's wrong? What happened?
My mom whipped me.
Oh, okay. We're gonna go
It's
to
all
your...
bruised up too.
Okay, we're gonna take a look. So we'll be right over here. You can go ahead and lay flat on the bed. So, we're going to do a renal ultrasound. Okay?
Okay.
So we're just gonna look at your kidneys. Have you ever had an ultrasound before?
No.
Okay, well all we're gonna do is rub some jelly on your belly and look with an ultrasound probe, okay?
Okay.
It won't be too bad. I'm gonna need you to raise up your shirt for me. And I'm gonna look right here, okay?
Okay. Hurts really bad, so be careful.
Okay, I'll be gentle. Okay, we're all done with the exam. I'm gonna actually have you lay right here. I'm gonna go make a phone call and I'll be right back, okay?
Okay.
Hey, I just scanned this kid and she said that her mom whipped her. Like right on her side.
Really?
So, do you think I should call DHS? Like, it really hurt her. And she's experiencing problems with it.
Absolutely, then, yeah, I think we have an obligation to do so.
Okay.
Yeah.
Hi, I'd like to report some parents for mistreatment of a child. Okay, this is Tara. She's my supervisor.
Hi, Miss Laura, how are you?
Good.
We're a little bit concerned about this injury here to your side, and you said that it was your mom that whipped you?
Yes.
Okay, well, we're gonna need to speak to your mom, okay?
My mom is out there in the waiting room.
She is, okay, well, you just hang tight right here and we'll be back, okay?
Okay.
Okay, so we just scanned a child that seems to have sustained some kind of injury from her mother. She says that her mom whipped her. She has like a huge hematoma on her kidney, so.
And she's in a lot of pain.
Right. I think maybe we should.
Investigate.
Okay, we'll go do that.
Okay.
Excuse me, ma'am. Are you Miss Laura's mother?
What?
I'm told that something hurts on her side from getting whipped.
Oh, well, yeah, so I was working on my dance moves. I've got this incredible gig coming up. And, you know, I was whipping, and then she was just right next to me, and I didn't realize it, and I, like, made her fall over and hurt herself.
So you have not whipped your child?
Oh, I mean, like, other than, you know, the whipping nay-nay.
You're gripping your side.
My side hurts really, really bad.
What's wrong? What happened?
My mom whipped me.
Oh, okay. We're gonna go
It's
to
all
your...
bruised up too.
Okay, we're gonna take a look. So we'll be right over here. You can go ahead and lay flat on the bed. So, we're going to do a renal ultrasound, okay?
Okay.
So we're just gonna look at your kidneys. Have you ever had an ultrasound before?
No.
Okay, well, all we're gonna do is rub some jelly on your belly and look with an ultrasound probe, okay?
Okay.
It won't be too bad.
She whipped me then, but it was on accident.
Oh, okay. I was very confused because whipping sounds like someone actually holding a whip, like, you know, whipping.
Oh, no, she just whipped me from
Oh,
dancing.
from dancing. Okay.
Are you okay?
Ouch, my side hurts
Oh,
really
no,
bad.
she just whipped me from
Oh,
dancing.
from dancing. Okay, that's slightly better. Okay.
In the first scenario, Jim didn't ask Shane to describe thoroughly what happened, and he misunderstood, so he got DHS involved whenever they didn't need to be. In the second scenario, Jim asked Shane to describe it very thoroughly, so he was able to understand what happened to her and realize that it was an accident.